Imagine a single nerve that connects your brain to your heart, lungs, and nearly every organ in your belly. This is the vagus nerve, a remarkable messenger in your body at the heart of so many essential functions. But what happens when the vagus nerve stops working as it should? Today, let's unravel the mystery of vagus nerve dysfunction, what it is, how it feels, and why recognizing it matters. The vagus nerve, whose name comes from the Latin word for wandering, meanders through the body like a hidden highway. It's the longest cranial nerve, stretching from the brainstem down the neck, through the chest, and into the abdomen. At every stop, it relays signals that keep your body in balance, slowing your heart rate, stimulating digestion, even helping you breathe. Thanks to the vagus nerve, your body's unconscious systems, heartbeat, swallowing, sweating, and more, run smoothly behind the scenes. This automatic balancing act is called the parasympathetic nervous system, often known as the rest and digest system. When the vagus nerve falters, these vital processes can begin to unravel. So, what exactly is vagus nerve dysfunction? Simply put, it's when the vagus nerve can't send and receive messages properly. Sometimes the nerve is overactive, sometimes it's sluggish, and sometimes signals don't travel at all. Causes range from medical conditions like diabetes and autoimmune disorders to physical injury or even surgery affecting the nerve. The results can be wide-ranging and puzzling because the vagus nerve affects so much. You might notice heart issues like a rapid or irregular heartbeat, or find yourself getting faint or dizzy, especially when you stand up quickly. Digestive struggles are also common. Trouble swallowing, frequent nausea, bloating, or unexplained vomiting may signal a disruption. Some people experience a chronic cough, a hoarse voice, or a constant sensation of a lump in their throat. Others may have breathing difficulties or unusual changes in sweating. But vagus nerve dysfunction doesn't just affect your body, it influences your mind too. Anxiety can rise, and you might feel inexplicably tired or mentally foggy. New sensitivities to noise, light, or pain might also surface. Because these symptoms cross over with so many different health issues, vagus nerve dysfunction can be hard to pinpoint. What should you do if you recognize these warning signs? A conversation with your healthcare provider is the most important next step. Diagnosis often involves a detailed discussion about your symptoms, medical history, and may include physical exams or specialized tests. Sometimes, doctors use heart rate, blood pressure measurements, or swallowing tests to check if the vagus nerve is working correctly. Treatment depends on the underlying cause and specific symptoms. For some, addressing conditions like diabetes or inflammation can help. Therapies such as physical therapy, voice and swallowing exercises, and sometimes medications can improve the nerve's function. In rare cases, a device called a vagus nerve stimulator is implanted to help restore balance. If you or someone you care about has been experiencing the subtle signals of vagus nerve dysfunction, know that you're not alone. Early recognition, consultation, and management can make a difference, bringing the body's complex orchestra back into harmony. Our bodies depend on the silent work of the vagus nerve each day, guiding vital rhythms behind the scenes. Understanding its role and knowing the signs of dysfunction empowers you to take charge of your health and well-being. Trust your instincts, seek help when you need it, and let knowledge be your guide.